Okay, so we'll make a start on this afternoon's session. I'm delighted to introduce you to Colin Morrison from the Children's Parliament and Professor David Porteous from Generation Scotland at the University of Edinburgh. And so this is a combined session this afternoon in which both Colin and David are going to be sharing the findings with us from two surveys which were issued in Scotland during the COVID lockdown to young people. So obviously, as the situation continues, it's really interesting to be able to look back at that first stage and see what the findings were telling us. And then obviously we'll have some time for questions, and I'm sure there will be many at the end of this session. So we're going to start this afternoon with Dr. Colin Morrison, who is going to talk to us about understanding the findings from the Children's Parliament survey, which was for 8 to 14 years and was called How Are You Doing? So Colin, if you would like to share your slides, I will hand over to you just now.
Great, thank you very much. Let's see if I can manage the technology. It's always a challenge. Here we go. So yeah, thank you for the invitation. I wanted to tell you a wee bit about some of our work over the last few months in response to the pandemic. I have a few slides that are a bit busy, but I was thinking that if this is something that people want to return to later, then that would be a better time to kind of dig deep and maybe use some of the direct quotes that we've used from children. So just one slide about us. We are Scotland's Centre for Excellence for Children's Participation and Engagement. And you'll see our dream is that children grow up in a world of love, happiness and understanding. So we're all about the UN Convention on the Rights of the Child. So obviously the recent announcements about the UNCRC incorporation bill is something that we're very excited about and something that's going to impact on all our work and we believe on the lives of children and young people. So it's exciting times for us. As an organisation, we are at 25 years old next year. So it's a great year for us to be having that birthday and to also be thinking about what incorporation means for children and young people. I was going to tell you a wee bit today about several bits of the work that we've been doing that's a kind of programme of work around children and coronavirus. One of them is obviously this survey that's been called How Are You Doing? And that was conducted April, May and June. And then we had a bit of a rest over summer and we currently have our September, our final survey up at the moment, and I'll come back to that. But the slides also pull some information from our Corona Times journal. And what we did was we asked 14 children that we're working with to write for us over the period as well. So we are just about to publish the 6th journal, and the children have been talking about the experiences of the pandemic, of learning at home, relationships, all those kind of things that we'll cover in this presentation. And that's all reported on our website. And then more recently, for the schools going back, we published an online resource called Back to School, a rights-based approach to recovery. And it's a resource around 6 themes with 30+ activities that educators can use in that kind of, what we envisage to be a kind of recovery curriculum, if you like. So a way to help children to reflect on experiences and to get back to learning. And then finally, we've just started a relatively small piece of work, but we're just speaking with parents and children under 7. There has been some work around parents conducted over the last few months, less so in direct engagement with 3 to 7-year-olds. So we're doing a bit of that work just now with 15 families. So that makes up our kind of programme of work. In terms of the survey, here's just a wee bit of information about who's been taking part over the months. With the numbers, the age range. So in the reporting, we decided when we looked at what was coming out to do a wee bit of a focus on if there were differences or similarities between the younger children and the older children. So our age range at Children's Parliament is early years and middle childhood. So this particular piece of work looked at 8 to 14-year-olds, which would generally be the upper limit that we would work with. So there are interesting results in terms of the ages of the children who've responded, and then some information about the sex of children as well. sorry, I should have just said. So the statement's made up of 31 statements with that 5-point scale of strongly agree to strongly disagree. Now, this work comes from work that we had developed some time ago. Back in 2013, 2014, we developed a survey tool to look at a subjective measure of well-being. Back at the time, we felt that there was, and there still are, a lot of surveys and around that maybe don't capture particularly younger children's experiences, but didn't really capture subjective views. So we do a lot of counting of things. We ask children if they've smoked a cigarette, you know, those kind of questions. But we were interested in a more subjective measure. So we developed a tool with children over several months, and we tested that, and we were kind of looking towards final development of that when the Scottish Government announced that there would be a school health census. So some of you might have been involved in that over the last few years. That still hasn't come to fruition finally, as far as I understand it. But at the time, we decided just to hand over the work that we had done to that process. But as I say, that's still not in place. So we were able to return to work that we'd done, a lot of testing. So all of the content of this particular survey is taken from previous work. And so we had some confidence that children would understand the statements and be able to respond. One of the key things, and I'm sure will be of interest to most of the audience today, is about learning at home. So we appreciate that the closure of schools was a necessary response. When that decision was made, there was little or no consultation with children or young people, or with education professionals for that matter. As lockdown progressed, we've kind of measured, we've reported so far on April, May and June, and we've kind of seen a decline in the numbers of children who were connecting with that learning, enjoying that kind of learning at home. And I think particularly the 12 to 14-year-olds have struggled more than, at least in our sample anyway, than the younger children. I've pulled out a few, in the next couple of slides, a few of the statements, not all of them, but just to give you a wee bit of a picture of how that has changed over time. I pulled out the feeling safe online question because I think it's a huge shift in the kind of children's access to various digital platforms, and certainly in the work we do with parents, we've heard how boundaries have shifted, rules have changed. So I think this is going to be an ongoing issue for us. So we were asking, do you feel safe when you're online? So I think almost children say they do. There are still those that don't. And of course there can be various issues. The quote on the left is one of the quotes from our Corona Times journalists. All the children had pseudonyms, which is why you'll see the creative songstress here was telling us that she's really kind of struggled with learning over time. So some of the things we asked were things like, do you have fun things to do in your day? We looked at that kind of level of intrinsic motivation that a child would need to learn. So we were asking whether they do something, when they do something, do they try their hardest? These kind of questions. And we saw, well, most children were doing fine. There was a kind of decline over time. And again, a difference often between boys and girls, or between the older children and the younger children. Another quote on the left from one of our journalists. Actually, two of our journalists have really quite complex issues with dyslexia, and their learning over the past few months has been very challenging for them, I would say, and a lot of reliance on parents trying to do the kind of support that they needed. Again, a couple of quotes, probably just on that, we'll capture just that middle block of text there. When children were asked if, straightforward yes or no kind of question, if they worried about doing their schoolwork, and that increased over time to 43% of children in June who had a worry about doing schoolwork at home. So a range of experiences. In terms of learning, I would say that from what we've been doing over the last few months, most children didn't like the model, and many have struggled to engage despite the best efforts of many teachers. We were interested in family and friends, and most children report they liked a lot of aspects of being in lockdown with family. Although numbers are small, there were kind of statistically significant changes in terms of girls who were reporting increased vulnerability, a lack of feeling safe at home. And I'm sure all of you in your workplace now are picking up on some of these child protection concerns that were a bit less obvious during lockdown, and for many children may have kind of been exaggerated, those kind of risks and experiences that you'll be picking up now back at school. The worries about money were a kind of key feature in the things we found, and I can't give you too much on what's happening with the current September survey, but it's interesting that as we stand and the response we've had so far, although we're not closing till next week, that number of children reporting worry about money, parental worry about money, has gone up a bit over time. And in terms of health and well-being, there was a general decline over lockdown, we felt, from children feeling increasingly lonely, less sure that even if they were having a difficult time, they would be okay, identifying a number of things that, fewer things that made them feel good over time. I love this quote from this 8-year-old journalist that we have. The not so good things that me and my mummy can argue about because we're stuck together, like someone put glue on us and we're trapped together. It's really kind of a lovely way to describe that bit of stress that they were going through at the time. I just picked out one of the things around physical activity. Obviously these things there was a lot of restrictions. A lot of children and young people did not have access to outdoor spaces, to gardens, never mind to anything else to do. They couldn't go to their football training, couldn't be out on their scooter, all those things. So I think over time we need to be thinking about the impact that has on, if we're worried about sedentary lifestyles, then we need to think about the consequences of the last few months. And a small but significant number of children responded that they didn't have someone to speak to if they had a worry either in their family or someone external to their family. And obviously that's where teachers and educators come in now, in terms of being a trusted adult, a person that a child can go to if they have a worry. So I'm rattling through these things. There's obviously a lot of information, but the one thing that we're interested in Children's Parliament, and also in terms of UN Convention on the Child Rights, is about access to information, expressing opinions and experiencing those rights. So we've had quite a public debate in the last few weeks about, for example, the First Minister's broadcasts at lunchtime and about how dependent people are on them for information. And certainly our journalists have spoken a lot about that moment in the day where they would listen to those with a parent or carer. It became quite a focus for some families. But there's a real kind of need here, I think, which again is a key role for the educator, about how we allow children space to talk about things, but also make sure they're accessing enough information and accurate information over time. This slide's rather busy, but it just kind of focuses on our key concerns, and particularly for 12 to 14-year-old girls. So across the piece, they fared really a lot less well than either boys of the same age or the younger boys and girls. So least likely to report having fun things to do, to be proud of things. Well, you can see the list if you want to scan that quite quickly. So this is a kind of a standout for us and something for us to be concerned about. So for those of you in secondary school settings, these are the children who have come up from P7 into S1, missed all those normal transitions, and children who have gone from into S2 and into S3. So yeah, something for us to really pay some attention to, I think, and think about the experience of girls. There's no doubt as well that some children had some things that they liked about being in lockdown. For a lot of children, there was less stress. If school is at all stressful, there was less stress in not being able to go to school. A lot of parents did a great job in supporting their children to learn. We had lots of reports about baking and various other things that people were enjoying doing together that they maybe didn't normally have the time to do. But probably this journal that I'm currently editing, the final one, in terms of their return to school, pretty much all our children are saying that it was time to go back and that they're happy to be back in school. So just the last couple of slides now, really. If we're in a period of recovery, our concern is that people feel that we can get back to normal, whatever normal was. Normal wasn't very good for a lot of children and families at the best of times, but certainly if we're back at school, we would like to encourage our colleagues in education to think about, to take some time for recovery and to talk about children's experiences and to spend time talking about how they're coping and managing now. So that's the reason kind of behind the back to school resource, which is freely available. And in the final slide really is just to, we have our final survey and it's open until September 30th. If you can direct children to it, it takes 6-7 minutes to complete. We've also produced a lesson, an activity that teachers can use about surveys and the scale that we've used in the survey. So there's a wee bit of possibility of doing a wee bit of work with children to prepare them to do the actual survey itself. Thank you.
Thank you very much. It was a fantastic presentation there, really interesting. And I would thoroughly recommend that people take the time to have a look at those quotes when we put these sessions, when we record them and put them on the website. I've had the luxury of being able to read through them. And after all, surveys are not just about numbers, it's pupil voice. They're giving us the trends, and it's really nice to see that in the journalists' quotes. That really brings that home, that this is what the children are telling us. I think if we maybe take 1 or 2 questions just now pertinent to Colin's presentation, if there are any, before we move on to the TeenCOVIDLife survey. And then at the end, we can have a bigger Q&A session from both, just if there were any burning questions now. Give it a couple of minutes in case anybody types them in. No? Okay, right, so we will have obviously a much bigger Q&A session at the end. So thank you again, Dr. Colin Morrison from the Children's Parliament. So we're going to move now to the second presentation within this session. And this is looking at the TeenCOVIDLife survey for 12 to 17-year-olds. I'm delighted to introduce to you Professor David Porteous, who is the Principal Investigator with Generation Scotland. Shine were delighted to collaborate with TeenCOVIDLife, with the TeenCOVIDLife team. And so I will hand over to you now. So you're on mute, David, at the moment, so you might want to unmute. There we go. No,
Digital hassle. Yes, thanks very much. Yes, I'm David Porteous. I'm a professor at the University of Edinburgh at the Centre for Genomic and Experimental Medicine, and also at the Centre for Medical Informatics. Wait a minute. Don, what the talk that I'm seeing is not my talk. Don, I've lost you. Don, the talk that's come up from you is not my talk.
Okay.
Don't understand that.
That was the one that was sent across.
Oh God, pardon my language. Let me just try my screen share again, if you don't mind.
Okay, David, if we give you a few minutes just to have a look into that, maybe Colin, if I bring you back in just now, I see there's a question in the Q&A box, so that will allow David.
Let me just try this again, Don.
Okay. Okay, so question for you, Colin, which is about whether you're aware of anyone carrying out the survey to see how school staff are coping with the return from lockdown.
No, I don't know anybody who's doing that work, and clearly that's important to do. I don't know what the teaching unions are doing on this, but they may well be doing something, but I don't know, sorry.
I know that the EIS did a fairly comprehensive survey earlier in the year. So there was, they have been collecting some data. Okay, now I think we're up and running. David?
Is that now looking okay?
It is, yep.
Fantastic. Right, sorry for that delay.
That's okay.
So I've done the introduction. First of all, to say it's been a fantastic day. I've really enjoyed it. I've learnt so much. So thanks for giving me 20 minutes to just talk to you about what we've been up to. And this is very much a collaboration with the SHINE team, but I'll give you a little bit more context, if I may. And oh dear, now the problem is it's not moving on. Right, okay, yes, that's now working. Right, so this is about our TeenCOVIDLife survey series as part of Generation Scotland. It's all about feeling and coping under lockdown and beyond. And it's a partnership, as I said, between SHINE and ourselves. And I just want to start with a few acknowledgements. This is from the University of Edinburgh. Our funding comes from the Chief Scientist Office. It's a partnership with NHS Scotland. We've also had funding from the MRC and HDR UK, but the Wellcome Trust are our main funders now, and they've really helped to push this research on. There's a great team of co-Is in Edinburgh, but the team are the people that really need to be thanked for this. In particular, the team of Archie Campbell and Robin Flagg, who are my right-hand people, but Chloe Fons-Ritchie, who's done all of the questionnaire design, and Drew, who's been helping with the analysis, Rebecca on the public engagement, Steph on the TeenCOVIDLife in particular, Alison Forbes on the rural life study, and then Rachel, Louise and Sharon have all been helping in the background. It's quite a collaborative effort, but the real collaboration today is about the link with Danny, Joanna, Judith, Dawn and Judith on the SHINE team. But I want to take you back to just where we were last year. And the SHINE team and Generation Scotland were both at a meeting led by MQ, a mental health research charity in Edinburgh. And there's a photograph there which shows how different life was there. There's no social distancing, there's no rule of 6. In the foreground, or in the middle ground, I should say, Archie Campbell's in conversation with somebody, but at the back is the SHINE team with their display. And they were really launching the SHINE survey from 2018. And I picked that up and had a great conversation with Dawn, went away with it and talked to our team. And it gave us thoughts, I must say, that are now starting to come to fruition. At that time, we were just a small team, myself, Rachel and Archie, and we were running the Generation Scotland programme. And I want to set this into some sort of context for you. So this study is about genetic and environmental influences on physical and mental health. To date, we've got 24,000 participants in 7,000 families, and these were recruited between 2006 and 2011, and they were all 18 and over. So they're a good bit older than that now, and we want to be thinking about the younger generation too. The way that we operate is that we have this very strong link with the NHS in Scotland, and I'm sure you're aware that the NHS in Scotland is particularly thoughtful about the way that they collect data, and with appropriate ethical approval, we as researchers can link that to our own data. And so what we were doing, we're asking people to come to a clinic for a kind of top to bottom health check, but asking particular questions about mental health and well-being to link that into physical health. And then asking them for their approval to link into their NHS records, everything from blood samples collected at GP surgeries through to prescriptions, and link that in with the data that we were collecting. And this is done under a very carefully overseen, regulated and secure and safe way, which allows us to maintain volunteer confidentiality, but take advantage of the richness and long-standing nature of NHS records in Scotland. We made a particular emphasis around mental health, and the reason for that is pretty straightforward. Depression is second only to heart disease as a cause of disability worldwide. And as I think we all recognize, depression often lurks just beneath the surface. And we've done a lot of work to look at this, to see what are all the factors that affect it. Early childhood events are crucial, from womb to young children and effects on their lives, lifestyle, work balance, work-life balance. And of course, we recognize that a lot of these things do tend to run in families. So it's important for us to take into account genetic factors and the role of the genetic dice, if you like, all of which leads to the way in which our brains develop and how we think, process, and how it affects our behavior. So there we were in 2019 in receipt of a large grant from the Wellcome Trust, which was aimed at doubling the size of the cohort and recruiting the next generation. And our aim was to recruit from age 12 and up, to use the NHS Scotland data to track health and well-being from birth to death, and to use online questionnaires, health and well-being apps and devices, smartphones and wearables, and to collect remotely through postal collections saliva and blood samples for our genetic studies and biomarkers, and to use all of this to do what we now call disease stratification and prediction in an open science way. And I'm not going to go into that in any more detail, really, except to emphasize again how important it is that we start these studies early and don't wait until adult life, because the adolescent brain is when so many things start to happen. It's a time of very rapid learning and brain development, and it's a period of vulnerability, but also of opportunity to intervene, vulnerability to those changes, and to, of course, in the context of modern society, dramatic changes in the kind of society that today's adolescents are being brought up in compared to the previous generation, the parents' generation. So there we were in 2019 with a new team on board. And by early March 2020, we were all set to recruit our new volunteers. But we know what happened next. And COVID-19 changed everything. We were all asked to stay at home to help protect the NHS and save lives. What we wanted to do was to not focus so much on the things that we were starting to learn very quickly about the impact of COVID-19 as a major health concern, the factors of age and underlying ill health and how sex affected it, how occupation and ethnicity affected it, but about the indirect effects on health and well-being. How are people coping and feeling under lockdown? So we changed tack completely. The team moved over entirely to doing our COVIDLife surveys, and we managed to recruit 3 more members to the team, Drew, Steph and Ali, who have been contributing to these studies. So the key for us was to make sure that we asked questions about living under COVID to do with personal experience of COVID-19. Had a member of your household experienced COVID-19 signs and symptoms? What was your general health like? Tell us about the household, tell us about your education and employment. But crucially, how are you feeling in coping? So this is very much about the psychological, social and economic impact of COVID-19 mitigation measures. We started off with a survey of adults. 18,800 answered our first survey between April and May, and 11,000 of them have completed our second survey as lockdown eased. But more of that later. Now let's turn to the TeenCOVIDLife survey. With the help of Shine and the promotion through the Shine network of schools, 5,512 to 17s completed the first survey, which we ran between the 22nd May and 5th of July. So under homeschooling, but before exam results. Survey 2 is ongoing until the 30th of September, after exam results have been moderated and when the children are back to school. We looked very carefully at the Health and Wellbeing School Report and borrowed many of the same questions as for the Shine HBS report, plus many more of our own, asking specific questions about how children were feeling and coping before lockdown, how they were feeling and coping now under lockdown, and how was homeschooling going, and what worried you most, and what about exams, and what about your future. So I don't have time to go into all of the details, but I'll give you a brief summary of some of the key findings. If this slide would move on. Oh dear.
There we go.
Okay, right. So this infographic just gives you a picture overall. 5,500 surveys completed from 283 schools across 32 local authorities. Unsurprisingly, as happens with all of these surveys, more girls than boys answered it, about 2 to 1 ratio. 46% found that it was quite or very difficult to adjust to homeschooling. If we could have the next slide. Dawn, next slide.
Sorry, there we go.
40% were stressed under COVID-19 some of the time, 50% most of the time, and 7% all of the time. It's quite a high level there. Interestingly, under sleep, we talked about this earlier, 20% reported better sleep, but 3 in 4 were going to bed later. And goodness knows what time that was, if 3 o'clock in the morning was the average beforehand. 40% reported having worse quality of sleep. So again, these are things that we need to delve into a little bit in more detail. But if I have the next slide, you'll see also that loneliness was something which increased after lockdown, as did worry. And there were a number of causes of increased worry. They were worried about their education, they were worried about exams, and they were worried about the future. If we can have the next slide, please. And in terms of happiness and well-being, we saw that there was an increased proportion of individuals who were reporting low happiness, particularly with life in general and the future. In terms of mood, both girls and boys were reporting more low mood, but it was particularly strong amongst female volunteers. Could I have the next slide, please, Dawn? But there were some positives here too, because one of the things that was encouraging to see was the extent to which children felt that they were getting the support they needed from their schools and from their families, or from a special friend that was able to help them. Could I have the next slide, please, Dawn? So if you look at the full report, you'll see that we've presented it as far as possible in the same format as for the SHINE report from 2018. This is just one example of the kind of analysis that we've broken down for unhappiness, showing that older children in general were less happy than younger children. So we've broken this down between the 15 to 17s and the 12 to 14s, and that girls are generally less happy than boys. And it's this factor that they're most unhappy about life in general and the future, or the prospects for the future. Next slide, Dawn, please. So I want to just tell you a little bit about how that links into how the adults have been coping. And the next slide will show you that one of the key findings there is that younger adults are most affected. We've asked questions about how you are feeling before and after lockdown, and feelings of loneliness and isolation have increased across the age ranges, but it's most predominant amongst younger adults, the school leavers, those who will be now going off to university, and those who are starting their careers. In the next slide. Again, here what we're plotting is the anxiety and depression, and the more dark blue there is, the worse things are. And you'll see that moving from left to right, it's the younger age group that are most affected in terms of their anxiety and in terms of their depression. So the next slide also shows that one of the things that's very striking is that measures of life satisfaction have plummeted. On the left, the APS results are the results from surveys that are run annually. And over the past decade, even after the economic crash in 2008, life satisfaction in general has stayed remarkably stable in Scotland. And it was pretty much the same before lockdown in our survey group. But after lockdown, life satisfaction really has plummeted. Levels like this have never been seen before by our health economists, David Bell and Elaine in sterling. Nearly half of respondents were worried about post-COVID employment and economic recovery, particularly the young. If I could have the next slide, please. So I think these are just the closing thoughts on the impact of COVID-19. It's changed everything for everyone, but not equally. The indirect effects are severe and the consequences are long-lasting. It's affecting the well-being of teenagers and younger adults more than older adults. It's interrupted schooling in an unprecedented way. Homeschooling has affected disadvantaged pupils more than others, and teachers, pupils, and parents are all facing a tough year ahead. So catch-up and adaptation will be challenging, and school leavers face a fundamentally changed world, adult world. And I do feel for those who have left school without the normal fanfare and fun and are heading off to university, but to a very, very different type of university from the university education that I and most of you on this at this meeting will have experienced. If I could have the next slide, Dawn. So just to end on that note, just to find out more, our Generation Scotland website tells you all about what we do. All our surveys are published on the website, and you can find more about the TeenCOVIDLife survey at that website. I would just put out a plea and a promise that if you could promote the survey, the TeenCOVIDLife survey too, it would be great, because we'd love to get some more responses to the second survey and report that back to you. The promise is that we will continue to do these surveys and publish them and make them available on our website. And with that, I'll stop later than I should be, but hopefully with still some time for some questions. Thanks.
Thank you very much, David, and thank you for persevering with that. Now, just another wee thing, David, because you've got the two screens there. We're on the other screen, so you may wish to look at the other one, but I didn't want to interrupt you earlier because I know we're all minimized anyway.
Right. Okay.
Thank you very much to both of you for those different perspectives, but obviously on the same era that we're all experiencing, and I can see the questions coming in already. So I will begin the comments actually to say, that was 3 of the previous comments. So David, how quickly do you think we will see an analysis of the second TeenLife report?
There's a lot of information that comes over in the report, and it does take some time to do it, but a summary report I would expect us to have with you within October. Mm-hmm. So the headline report will be made available in October.
Mm-hmm. Okay. That's great. And any more questions coming in? That's one. Yep, one coming in. So, and when are the next rounds due for the for these surveys?
It's a very good question. I think that we had thought naively that we were moving into a period of relative calm, and we're not. So the timing of the next surveys, we've always said the timing of the next surveys will be determined by events. And I think we've hit another event. And I think the message that's coming out of Westminster and from Holyrood is that we have to expect that life will be as it is now, rule of 6, limited household changes for some time to come, and will only change as and when the data suggests that we are moving back to an R of less than 1 with confidence. Mm-hmm. So I could almost put the question back to you and your attendees to ask, when do you think it would be most useful to have a further survey of the teens, the school-age children.
Mm-hmm. It's probably worth saying, obviously for the Shine schools that are amongst us, obviously you'll be aware that we're running the mental health online.
Yes. Remind me how long you plan to keep that going for.
Well, it's an open resource, so all the schools have it and they can use it as and when. And it's probably worth saying that some of the mental health survey questions were in TeenCOVIDLife. So Judith Mabelis, who spoke earlier,
yes,
closely with the Generation Scotland team to use some of those questions. So there are direct links between the TeenCOVIDLife survey and the Shine mental health.
yes.
So the schools have that as a flexible course that they can use.
In some ways, we think it might be wise to, given particularly that you are running that we might be wise for us to hold off until the new year, the calendar year. We're very interested also in offering to see any way that would be useful to any schools. Is there ways in which we can supplement what we're doing that would be supportive for PSE? And for that, we'd be very happy to have discussions through Shine or directly with individual schools. And I would also note that we've had a couple of really interesting talks about issues relating to schools in more rural areas and in the islands, and we are going to be launching Rural COVID Life shortly, and be very interested to talk to schools that are working rurally in rural communities where there are clearly additional issues that distinguish how COVID-19 affects them compared to urban areas.
And that links beautifully with one of our Shine case studies that we had earlier from high school.
Yes.
Again, looking at that rural picture.
Yes.
So, question here about this is maybe for both of you. Are you correlating any of your data with other surveys? For example, the Scottish Youth Parliament's surveys.
Colin should perhaps answer, and I can follow on. I have something I can say.
We have a kind of ongoing relationship with SYP, who work with older young people, so and connect into the same kind of policy teams. And so they've been using their lockdown, lowdown results and their subsequent social media work, just as we've been using ours to kind of take children and young people's voices across that full age spectrum, if you like. So we continue to work with them. We, in terms of ongoing concepts that are, actually what I'm trying to do just now is make sense of what's happening with parents and very young children. So there's a number of people doing small bits of work, some larger bits of work, trying to capture the experiences of under 7s and parents. So we're hopefully going to try and pull that together a wee bit, because it does feel a wee bit disparate at the moment. And I think there'll be benefits in doing that. So it's a job to be done. This will be our 4th kind of data point. So we're kind of keen to write up our results for how are you doing survey. We're happy to share that. We've got a couple of academics who want access to the data, and they can have it. And our public health colleagues also have all the data, so they can do some longer term work with that. They would have the resources to do that, so it's available.
That's great.
Just to add to that, Dawn, what we have is, well, a couple of things I can say. First of all, we've formatted all of our questionnaires in a Qualtrics format, which is very easy to share. It's very simple to use, and can be shared with anyone that wants to run it in another for another group. We operate on the principle of open science, so we publish everything and we make it available. There's a very simple request that you can submit, just so that we can keep tabs on everyone who asks for the questionnaire. So all our questionnaires are available through that mechanism. The Wellcome Trust have taken a lot of interest in this, and they encouraged us to take on a larger role. We are doing so primarily with a group in Bristol that run the Avon Longitudinal study of parents and children, ALSPAC study. And between us, we are making questionnaires available to any of the population cohorts, the longitudinal studies in the UK. So we will be collecting a lot more information, largely from adult cohorts, but from a very diverse range of cohorts in lots of different cities and settings. The other thing that's happening is that we provide summaries of all of our data to the Scottish SAGE and Public Health Scotland, and into various other policy engines, if you like, because we do think that it's important that you get prompt. We use this kind of survey to give information to policymakers as soon as possible, and for them to realize just what the scale of the impact of COVID-19 is on health and well-being across the age range.
Thank you. And there's just an observation here, actually. And you asked the question to the attendees about how they felt about when the next survey should be. So I'll just read it out to you. We felt as a school who did the first COVID survey that we need more time to use the findings before we do the second survey at the end of September. Could this date be extended for the second survey?
Could it be extended? Was that the plea?
Yes.
I can take that back. We would definitely value having more respondents. We are also conscious that there is a fatigue around questionnaires to do with COVID-19. We were delighted with the response to TeenCOVIDLife 1. Which you actively promoted through the Shine network, and the response was fantastic because it was so well distributed around Scotland, and the numbers of respondents made it one of the largest studies of that age group in the UK by a long chalk. We haven't had as good a retention or as good a response to the second round, and perhaps we've misjudged just how much adjustment children and schools have needed getting back to school. So if you felt, for example, that if we ran it out until the October break, I could certainly take that back to the team and put a halt on our intention, which was to close it in September. What we're the balance we're trying to strike here is having timely responses and feedback, with also giving time for children in schools to respond. So I think if there was a strong feeling from this conference that holding the survey open for another week or two would be helpful to improve the numbers, then I would certainly take that back and change the census time. So you need to do one of your fantastic vote nows, Dawn.
Yes.
Tell me what the answer is.
I didn't have that lined up.
No, but maybe if you get a mood from the audience, or there's feedback later that says yes, please keep it open until the October break, then I'll listen to that and take it back to the team.
Yeah, I think obviously it's just been such a busy time for schools and for families.
Yes.
It's there's been so much going on. So I think as we are coming to the end of this session now, were there any other sort of closing comments from perhaps Colin that you wanted to make, or I see the questions are more observations actually than questions now. More support for the second COVID survey being extended. Okay, so that brings us to the close of this session. So it just remains for me to thank Dr. Colin Morrison, Professor David Porteous, very much for those insights into the findings from the COVID surveys. And I would thoroughly recommend that when these recordings are put on our website, that you take a moment to read the voices that have been amplified by the Children's Parliament survey. Some wonderful quotes in there and really great insights directly from the children involved. And obviously you can have a look at the TeenCOVIDLife national report on the website as advertised by David too. So I'm aware now, as we reach the end of this session, that some delegates will be leaving the conference now. The next event that we're going to have are the breakout rooms on a meeting. So I'm feeling quite brave now that we solved David's IT issues. So breakout rooms will be a piece of cake. So for those of you that are going to join us in the breakout rooms, I will see you at the start of that session. But for those of you that are leaving us just at this point, I'd like to thank you very much from all of us at the Shine team for being with us today. It's been a fantastic range of moments to learn, moments to share, and some really interesting presentations. So without further ado, I'm going to say huge thanks to Colin and David for lending us their time and their expertise this afternoon. And we look forward to hearing more from both surveys. Okay, thank you very much. I will close the session now.